Have you ever been sitting in a doctor's office, listening carefully, and they say something like, well, at your age, it's time for this test again, and you nod, maybe schedule it, maybe even go through with it because, hey, it's routine, right? It's what they always say, the more checkups, the better. Catch everything early. Stay ahead of it, that's the safe path, or so we're told. But let me ask you something that most folks don't. What if not all checkups after 70 are helpful? What if some of them, not all, but some, can actually hurt more than they help? I know that's hard to believe. We're raised to trust routine, to follow the calendar, to do what's expected because we think it's keeping us safe. But here's the truth that doesn't get talked about nearly enough. After a certain age, your body is no longer playing by the same rules. What worked at 50 might be risky at 75. What helped once might now cause harm. Unneeded stress, unnecessary surgeries, frightening test results that turn out to be nothing, and sometimes those procedures. They come with side effects that don't go away, not to mention the emotional toll, the worry, the fear, the feeling of something's wrong, when maybe nothing ever was. And if you're someone who cares for your aging parent, or if you're in your 70s or beyond, this isn't just theory. This is real life. These are choices being made every day by good people with good intentions, who just weren't told the full picture. That's why we're having this conversation today, because knowing what to say no to is just as important as knowing what to say yes to. In this video, I'm going to walk you through 5 common checkups that many older adults are still told they need. But after a certain age, they can actually cause more confusion, more anxiety, or even long-term harm than they ever prevent. Some of these will surprise you. And number 4? That one has even shocked medical professionals who've spent decades in the field. So stick with me. Watch closely. This might be one of the most important things you learn about aging well. And before we jump in, can I ask you something personal? Have you ever felt that knot in your stomach after a test result? That moment of panic, only to find out later it was nothing? Or maybe you've wondered if that scan, that screening, that poke or probe was ever even necessary. If so, drop a comment below that says health first, because that's what this is really about. Not fear, not skipping care, just making smart, thoughtful choices that protect you and your peace of mind. And if you care about aging wisely and safely, go ahead and subscribe to ElderWisdom. This channel is here to give you the kind of honest, compassionate advice that respects your time, your health, and your dignity. Let's begin with one of the most talked about procedures in senior healthcare, the colonoscopy. You see, Mr. Lawrence was 78 when he went in for what he thought would be just another routine check. His doctor suggested another colonoscopy, even though his last few had been completely clear. No polyps, no red flags, just a clean bill of health. But he didn't want to take any chances. He wanted to be thorough, so he agreed. They scheduled it. He did the prep, the fasting, the drinking, the discomfort. Then came the procedure. And for a moment, it all felt normal. But not long after, something went wrong. Mr. Lawrence ended up back in the hospital. Complications. A small tear in the colon. Something that rarely happens, but happens more often in people his age. What was meant to be precautionary turned into a frightening, painful experience that changed how he saw medical care from that day on. Now let's pause right there, because this story isn't meant to scare you, it's meant to open your eyes. The truth is, once you cross 75, the risks of a colonoscopy can quietly begin to outweigh the rewards. Yes, it's an important test. Yes, it saves lives when used wisely. But here's the key: after 75, especially if you've had clean screenings in the past and you're not showing any symptoms, the benefits begin to fade while the chances of complications quietly rise. We're talking about risks like intestinal bleeding, perforation of the colon, infections, reactions to sedation, things that the body of a 50-year-old might bounce back from, but for a 78-year-old, it can take a heavy toll. Now, most people think, well, it's better to be safe than sorry, right? Of course, that's a good instinct. It comes from love, from caution. But here's the twist most folks don't hear. More screening isn't always safer. Sometimes it's just more. See, the medical system is built to be proactive, and that's a good thing, but it's also built on one-size-fits-all models. And aging breaks that mold. After 70, your care needs to shift from find everything to do what truly helps. Here's something most people don't know. If your past colonoscopies were clear and you have no family history of colorectal cancer or new symptoms, there are other options that are less invasive and carry far fewer risks. There are stool-based tests, like the Heffit test or Cologuard. These don't involve sedation. No fasting, no tubes, just a sample, sent to a lab, done at home. And for many seniors, especially those over 75, these are often more than enough. Now, I want to be very clear here. I'm not telling you to refuse a colonoscopy. I'm saying ask questions. Ask why it's being recommended. Ask what the risks are at your age. Ask if there are safer options. Because your health isn't about checking every box. It's about choosing the right ones. And this test, it's just the beginning. Because there's another one just as common, just as trusted, and often just as questionable once you're past 70. Let's talk about routine mammograms. Especially for women in their mid-70s and beyond, the decision isn't as straightforward as you might think. Picture this. You're 76, just like Margaret. You feel fine, maybe a little stiff in the mornings, but nothing out of the ordinary. Your doctor's office calls to remind you that it's time for your annual mammogram. You shrug, schedule it, and figure it's another box to tick off the list. You arrive, change into that thin gown that never quite closes, and stand there while the machine presses down, tight, uncomfortable, but you've done it before. Then you wait for the results. A day later, the phone rings. Something looks suspicious. We need you back for more images. Your stomach drops. Your mind races. You barely sleep that night thinking, is this it? Why now? Back you go. More scans. Then a biopsy, needles, bruising, a bandage you have to keep dry. Days stretch into weeks as you wait for pathology. Every ache feels like a warning sign. Every glance in the mirror reminds you of the bandage on your chest. Friends tell you to stay positive, but inside the fear is loud. Finally, the call, it was benign. A false alarm. Relief washes over you, yes, but so does exhaustion. The pain, the stress, the medical bills, the what-if swirling in your head for weeks, all for something that never threatened your life in the first place. That was Margaret's story, and it's far more common than most people realize. There's the science behind it. After 75, especially if you have no family history of breast cancer, the chance that a routine mammogram will catch a life-threatening tumor drops sharply. Meanwhile, the odds of finding tiny, slow-growing abnormalities that would never harm you go up. Doctors call this overdiagnosis. And overdiagnosis leads straight to overtreatment. Extra scans, biopsies, surgeries, radiation, medications, all carrying side effects that are harder on an older body. Radiation can weaken bones already at risk for fractures. Surgery means anesthesia, recovery time, possible infections. Medications can clash with the pills you're already taking. And the emotional toll, weeks or months of fear, doesn't show up on any chart, but it's real, and it can chip away at your quality of life. So why do so many women still feel that skipping a mammogram at this age is irresponsible? Because we've spent decades hearing one message: early detection saves lives. And that's true for women in their 40s, 50s, even early 60s. But bodies change, risks change. And after 75, the math shifts. What once saved lives can now threaten peace of mind, mobility, and even longevity. Skipping a test doesn't mean ignoring your health. It means tailoring care to the season of life you're in. It means asking, will this test extend my healthy years, or could it shorten them by leading me down an unnecessary path? Here's what you can do right now. 1. Have an honest chat with your doctor. Bring up your personal history, your overall health, and your own comfort level with more procedures. 2. Ask about your real risk. No family history? No new symptoms? The conversation changes. 3. Consider stopping routine mammograms. Many professional guidelines say it's reasonable and often wise once you're past your mid-70s. 4. Stay body aware without living in fear. If you feel a new lump or notice a change, of course speak up. But routine, clockwork screening, it may be time to let it go. Remember, choosing not to test can be as healthy as choosing to test, when the evidence says the harm can outweigh the help. And routine mammograms aren't the only peace of mind checkups that can steal peace instead of giving it. Now let's talk about a health scan you see advertised everywhere, promising a full body report card, but for folks over 70, it can open the door to more harm than healing. Picture yourself at home on a quiet Saturday morning. You're flipping through channels when an ad pops up. Get a full body scan today for total peace of mind. Detect hidden dangers before it's too late. The voice is calm, the music gentle, the promise huge. You think, why not? I'm healthy, but who knows what's hiding inside? That's exactly what George, a spry 72-year-old, thought. He booked the scan that very week. The machine hummed, the technician smiled, and in less than an hour George walked out feeling responsible, like he'd just bought extra time on his life's warranty. 2 days later, though, the phone rang. "Mr. Collins, we found a small mass," they said. "It's probably nothing, but we need more tests." Suddenly George's peaceful mind was anything but peaceful. He went for a CT, then an MRI, then a biopsy. Each appointment meant fasting, needles, contrast dye, endless waiting rooms. He barely slept picturing worst-case scenarios. His family worried, calendars rearranged, bills piled up. Finally, weeks later, the verdict arrived. Benign, totally harmless. Something that would never have affected him if they'd never looked for it. Here's what most ads don't tell you. Full-body scans are like giant nets cast into crystal-clear water. They scoop up everything: tiny cysts, calcifications, scar tissue from a cold you had 30 years ago. Most of these findings are innocuous, but once they're spotted, doctors feel compelled to hunt them down. That often means radiation you didn't need, surgeries you didn't need, medications you didn't need, and stress that can steal weeks or months of joy. Radiologists call them incidentalomas. They are common, especially in older adults, because our bodies collect little quirks over time. Detecting more doesn't always mean living longer. Sometimes it just means living more anxiously. Yet the myth persists. More information is always better. Not true. Better information is better. Information rooted in symptoms, family history, or clear risk factors that is useful. Random fishing expeditions. Not so much. So what should you do? Start by asking a simple question. Am I having any symptoms that truly warrant a scan? If the answer is no, pause. Talk with your primary doctor, the one who knows your overall health, not a clinic that sells scans like coupons. If your doctor says, yes, a focused image here makes sense, great, but a blanket scan just because an ad whispered peace of mind, that kind of peace can cost far more than it gives. Because here's the deeper truth, at 70 plus, time and energy become your most precious currencies. You deserve to spend them on grandkids, on sunsets, on that book you keep meaning to read, not on hospital gowns and follow-up appointments for shadows that were never out to get you. And while full-body scans feel like a personal choice, the next test on our list is one many seniors, especially men, are practically pushed into without question. Let's talk about the PSA test for prostate cancer and why, after 70, it might be the riskiest routine check of all. All right, let's shift gears and talk about a screening that almost every man over 60 has heard about, the PSA test for prostate cancer. Imagine yourself in James' shoes. He's a 74-year-old veteran, still mowing his own lawn, still fixing the neighbor's leaky faucet. At his annual checkup, the doctor orders a PSA blood test just to be safe. A week later, the result comes back slightly high. Not sky high, just enough to raise an eyebrow. The nurse calls, voice calm but serious. James will need a follow-up biopsy to be sure. So James schedules it. He fasts, he rearranges appointments, he tries not to worry. The biopsy is uncomfortable, but doable. Then the phone rings again. There's a tiny cancerous spot, they say. We recommend surgery. In a flurry of white coats and consent forms, the operation is booked. Surgery day arrives. Anesthesia drifts him under. When James wakes up, the cancer is gone. But so is something else. Now he's dealing with incontinence, the sudden need to map every restroom, the fear of an accident in a grocery aisle, intimacy with his wife, different now, confidence, bruised. And here's the kicker, that little cancer was so slow growing, he probably would have lived out the rest of his days, never knowing it was there. Here's what's happening behind the numbers. Prostate cancers don't all march at the same pace. Many creep along so slowly that by the time you're in your 70s, they're unlikely to bother you before something else does. Meanwhile, the treatment, surgery, radiation, hormone therapy can bring lifelong side effects: leaking urine, erectile dysfunction, bowel problems. For some men, these side effects hit harder than the disease ever would have. But the myth sounds noble. Early detection saves lives. And sometimes it does. Yet with prostate cancer in older men, early detection can also mean early disability for a threat that poses little real danger. That's why many expert panels from the U.S. Preventive Services Task Force to international geriatric societies now say, if you're over 70, especially over 75, and not at high risk, it's often smarter to skip routine PSA screening. High risk means strong family history, certain genetic markers, or symptoms your doctor can ignore. But for the average healthy retiree, the scale tips toward harm. So what should you do? 1. Square up with your doctor. Ask, what's my personal risk? Not men in general, me. 2. Talk quality of life, not just years of life. A decade more with serious side effects may not feel like much of a win. 3. Consider watchful waiting or active surveillance. If a tiny, slow-moving cancer is found, monitoring it might be safer than attacking it. 4. Trust your gut. If every alarm bell inside says this doesn't feel right, get a second opinion. Remember, it's your body, your call. Because in the end, health isn't about chasing every possible danger. It's about guarding the life you actually live day in and day out. And speaking of chasing numbers, let's explore a checkup that seems totally harmless. Just a quick vial of blood. But after 70, those routine labs can open the door to a maze of over-medication and needless worry. Let's talk about routine blood work and why sometimes the sweetest words you can hear at your age are no tests today. Now let's pull back the curtain on something that sounds almost harmless. The routine blood draw, the little poke, the colorful tubes, the lab slip that feels like a gold star for being proactive. Routine blood work without symptoms. Imagine this story. Maybe it's your aunt, your neighbor, or even you down the road. Evelyn is 80, sharp as a tack, still winning at Scrabble on Sunday afternoons. Every 3 months, rain or shine, she heads to the clinic for routine labs. It's a habit that started decades ago and just kept going. One visit, the doctor calls, "Evelyn, your sodium is a little low. Nothing to panic about, but let's admit you for observation, just in case." Suddenly, Scrabble plans are off. She's in a hospital gown, hooked to IV fluids, alarms beeping through the night. Nurses wake her for checks. Meals come without salt. Water intake is limited. After 2 confusing days, she's discharged, tired, anxious, short 2 nights of sleep she'll never get back. A week later at follow-up, her sodium is perfectly fine. That tiny dip? Likely her body's new normal. The harmless shift that often happens as we age. All that stress, all those bills, for a number that never needed fixing. Here's the science the lab slip won't tell you. As we age, normal blood test ranges, crafted for 30-somethings, don't always fit. Slightly lower sodium, a touch higher creatinine, a hint of anemia, these can reflect the graceful adjustments of an older body, not a brewing disaster. But what happens in real life? One out-of-range value triggers a cascade, more tests, new pills, extra side effects. Before you know it, you're juggling medications for problems that never truly existed, what geriatricians call the treatment treadmill. The big misconception? If I test everything, I'll catch anything. Sounds smart, yet the truth is upside down. The more you hunt in an otherwise healthy, symptom-free senior, the more innocent quirks you'll find and feel pressured to fix. Those fixes come with costs. Side effects from diuretics or supplements. Falls from sudden blood pressure shifts. Kidney strain from contrast dyes or new drugs. Anxiety, the kind that steals precious sleep and joy. So what's the wiser path? 1. Test with a purpose. If you feel dizzy, unusually thirsty, or notice swelling, by all means, check those labs. But if you're sleeping well, eating well, moving well, numbers can wait. 2. Track how you feel, not just how you score. Keep a simple journal. Energy level, appetite, mood, activity. Patterns in real life beat single snapshots in a lab. 3. Ask your doctor to explain every draw. What are we looking for? How will the result change my treatment? If the answer is just routine, consider skipping it. 4. Respect gentle shifts. An 8-point swing in sodium might be your body's new rhythm, not a red siren. 5. Guard your calendar like gold. Every unnecessary appointment is an hour you could have spent with grandchildren, friends, or a favorite hobby. Because at this stage, health isn't a scavenger hunt for numbers. It's a balance of strength, comfort, and time well lived. Now, we've walked through colonoscopies, mammograms, full-body scans, PSA tests, and routine labs, all well-intentioned, all potentially harmful if taken on autopilot. In a moment, we'll weave these threads together and talk about what it really means to protect quality of life in our later years. But first, pause and breathe. Let the weight of these insights settle. Because the power to choose wisely, it starts with knowing you can say no thank you and still be doing the very best for your health. Take a slow breath with me. Let the numbers fade. Let the statistics settle and think of the face that matters most to you right now. Maybe it's your dad in his favorite chair, your mother humming in the kitchen, or perhaps it's the reflection staring back at you in the mirror. You can still see the tiny bruise on Mr. Lawrence's arm from that colonoscopy 4. You remember Margaret sitting in the waiting room clutching her purse between white knuckles? You picture George pacing the hallway while the CT machine warmed up. You feel James' heartbreak when life after surgery wasn't the victory he'd imagined. And you hear Evelyn's sigh of relief, mixed with regret, when she realized the hospital stay never needed to happen at all. Watching someone you love endure tests, tubes, and treatments that never should have happened, it cuts deep. It's not just the physical pain, though that alone is enough. It's the look in their eyes when they ask, was all of this necessary? It's the guilt you feel for encouraging the appointment, signing the consent, driving them there. We tell ourselves we're doing the right thing because the system must know best. But sometimes the system is louder than it is wise. So let's shift the lens. This moment, right here, isn't about skipping care. It's about choosing care. Care that honors real quality of life. Care that weighs every benefit against every burden and decides bravely, well, pass on that test. Because peace of mind also means freedom from needless fear. Imagine sitting across from the doctor and gently asking, can you walk me through how this test will truly change the plan? And if it won't, what else can we do? That single question can turn an assembly line appointment into a personalized conversation and can spare your loved one or yourself months of avoidable pain. When you speak up, you become an advocate. You're not just extending life, you're enriching it, protecting Sunday Scrabble games, morning walks, shared laughter at family dinners. That's the kind of medicine that can't be bottled and billed, yet it's the most powerful prescription there is. Feel that hope? Hold on to it. Because knowledge in your back pocket and courage on your tongue is a gift that grows every time you use it. All right, let's seal this wisdom in your memory. Colonoscopy after 75, think twice, especially if screenings have always been clear. Routine mammograms over 75, question the benefit, weigh the burden. Full body scans without symptoms, advertised peace may mask unnecessary turmoil. PSA test past 70, remember James, sometimes an untouched cancer is the safer cancer. Frequent just because blood work numbers aren't always the best storytellers of health. Now I'd love to hear from you. Have you or someone you care about ever gone through a test that ended up doing more harm than help? Share that story below. Your voice might be the beacon another family needs tonight. And if this conversation nudged your thinking, even a little, consider tapping that subscribe button. Here on Elder Wisdom, we sift through the noise so you can hear the truth with compassion, make clear choices, and live the golden years with dignity and confidence. Thank you for giving me these minutes of your life. Stay strong, stay informed, and above all, stay kind to yourself and those you love. I'll meet you right back here next time on Elder Wisdom.